My name is Antonio Anzueto. I'm a professor of medicine at the University of Texas in San Antonio. I'm the senior author of this manuscript. The publication describes a geographically sub-analysis of the TIOSPIR trial in patients enrolled in Asia. TIOSPIR is the largest randomized COPD study, 17,135 patients to date, and shows similar safety and exacerbations efficacy profile in TIOtropium given either the Respimat 5 of 2.5 micrograms and HandiHaler 18 micrograms. TIOtropium is an inhaled once-daily long-active anticholinergic bronchodilator for maintenance therapy in patients with COPD. Current GOLD guidelines recommend TIOtropium treatment for all disease severities. However, the guidelines do not differentiate treatment options according to potential geographic or cultural differences. In Asia, the prevalence of tobacco smoking and indoor pollution contributes to a rise in the incidence of COPD, causing a higher estimated COPD burden compared with the Western world. In addition, geographic or cultural difference may impact the local management of COPD. So the aims of this analysis were to compare the safety and efficacy of the three TIOtropium treatments, Respimat 5 and 2.5 micrograms, HandiHaler 18 micrograms, for the Asia cohort of the TIOSPIR, and this was a pre-specified sub-analysis. We wanted to determine difference in COPD outcomes between Asia and the rest of the world, for which the TIOtropium treatment arms were pooled, and this was post hoc. So in the methodology, we enrolled 17,135 patients in the TIOSPIR Global. 2,356 of them were recruited in Asia from China, India, the Republic of Korea, Malaysia, the Philippines, Taiwan, and Thailand. If we look at the baseline characteristics, compare the rest of the world with patients in Asia, we have in Asia proportionally more males and more severe COPD disease, but fewer cardiovascular comorbidities. And let's look at the primary endpoint. The time to all-cause death that is shown in this graph, the risk of death was similar across all TIOtropium treatment arms within Asia, as well as between Asia and the rest of the world. However, in Asia, had numerically fewer deaths due to cardiac disorders, and significantly more respiratory deaths, including to COPD. Other endpoint is time to exacerbation. We can look at the data from two different angles. One is treatment arms within Asia. The time to first exacerbation was similar between Respimat 5 micrograms and HandiHaler 18 micrograms. Time to first severe exacerbation associated with hospitalization was similar across all TIOtropium arms. When we compare the Asia patients versus the rest of the world, the time to the first exacerbation was lower in patients from the Asia region. However, severe exacerbations were more frequent compared with those from the rest of the world. In conclusions, our results are consistent with the global TIOSPIR finding. Patients in Asia display similar safety and exacerbations profiles for Respimat 5 micrograms and HandiHaler 18 micrograms. However, geographical difference in exacerbation profiles exists in patients from Asia compared with the rest of the world. So what are the implications of these findings? There are variations in the characteristics, symptoms, and outcomes that may even exist between cities in Asia, given the differences in exposure to biomass fuels or dusty jobs, as well as difference in infrastructure. Therefore, geographic differences in patients recruited may impact the likelihood of particular outcomes in trials of COPD and should be taken into consideration when applying results to different regions of the world in order to optimize patient management strategies. Thank you.